Here are 10 things that if you are looking for a regenerative medicine clinic, so a clinic that does dextrose prolotherapy, PRP, stem cell therapy, those types of injections, orthobiologic injections as we call them. Here are gonna be 10 things that you're gonna wanna look for that will help you to understand, is this a low tier clinic we're working with? Is this a mid-tier clinic we're working with? Or is this a high tier clinic that we are working with? Now, before I get into these, I want to say that there are many clinics out there who do orthobiologics, and there are a lot of them who are not going to do things at the highest level, and sometimes that's okay. Sometimes it's okay if some of these things I'm going to cover are not met, because they can still get a lot of healing done with the way that they approach things. But if you are the type of person who says, no, I want to work with a top tier clinic, these are going to be the 10 things that you're going to want to look for. The first thing is that the physician who does these injections, their entire clinical practice is centered around the orthobiologics and regenerative medicine. There are a lot of physicians out there who might dabble in prolotherapy or might dabble in PRP injections. They kind of do it as like a piece of their practice. And that may be well and good, because there are a lot of other things that people need help with. Hormones, gut health, brain health, things like that. But if you're going to want to work with a top tier clinic, you're going to want to find a provider who solely focuses on these regenerative injection therapies. The second thing that you're going to want to look for is a physician who is not going to just determine what structures you need treated based solely on your MRI. Now, MRIs are a really crucial part of understanding what's going on with someone's joint health, their pain, that type of stuff. But if the provider is only focusing on the MRI and not incorporating a high quality hands-on physical exam, then a lot of things could be missed. Your MRI might show 6 or 7 different things that are pathological or that are structurally different, but it may only be 2 or 3 of those that are actually causing pain, and there might be 1 or 2 things that are actually missed on the MRI that could be causing your pain. And so it may lead to over-treatment of some areas and under-treatment of other areas, which may result in you not getting the most effective treatment. And so that's something you're going to look for as well. The third one is that if you are talking with them and they're recommending you to get a series or a package of injections, then that may be a red flag that they're not a top tier clinic. What I mean by this is that if they say, oh, you've got a rotator cuff tear, and so we're going to need to do 3 PRP treatments in order to get you better. I don't necessarily agree with that, and a lot of the top tier clinics are not practicing that way. The way that they practice is they do 1 injection, they see how you respond, and then decide if you need another injection. If you're sold a package of 3 injections and you're 90% better after the first one, then what? A lot of these providers will say, well, we'll just do the other 2 injections as like insurance that this is going to last and it's going to stick. And in our opinion, that is not good quality top tier medicine in the regenerative injection space. And so try to stay away from clinics that are just going to make recommendations based on a package. The fourth thing is that the clinic is going to use advanced imaging like ultrasound and or x-ray in order to guide their needle safely and effectively into your targeted tissue that is contributing to your pain. Now, if we have a preference between those two, we're generally going to opt for ultrasound only. Some clinics don't have x-ray, and that's okay. They may be limited on certain things that they may or may not be able to do because they don't have that x-ray. But in our experience, in our opinion, if they only have x-ray, then there's a whole host of structures, tendons, ligaments, nerves, that are often not going to get adequate treatment because the x-ray is not really going to show those soft tissues very well. And so if there's only 1 of them, you want to opt for ultrasound, but ideally you're looking for a clinic that has the ability to do both x-ray and ultrasound. The 5th one, and I'm actually going to reframe this as a red flag, but if the provider tells you that you're too old to get PRP or you're too old to get stem cell therapy and that they're not going to work very well because you're too old and you need to now have stem cells in a vial, that's a red flag. there is a lot of evidence that these injections are going to work in older patients. When I say older, I mean patients in their 50s, 60s. We've even had patients in their 70s and 80s who have responded very well to properly dosed PRP and stem cell therapy injections. And so if a provider is telling you that you're too old to have your own stuff, one of the things I've heard is if your own stuff worked well, you would already be healed and you wouldn't be in chronic pain. That's not how this stuff works. And so that's going to be a red flag that you're not working with a top tier clinic. The sixth one is very similar to the fifth one. I'm going to try to differentiate these a little bit. So a good high quality clinic will understand that even if you're older, let's say over the age of 65, that PRP can still be a very effective therapy for you, and you don't necessarily have to bump up to something stronger like an autologous cellular therapy from bone marrow or adipose tissue. We have to make changes when we are working with our older patients, meaning that we actually have to dose higher in the PRP compared to someone in their 20s and 30s, but that doesn't mean you're not going to respond. And so a top tier clinic will understand that PRP can still be utilized for the older patient population, and it's not mandatory to go up to something stronger. The seventh is that you are working directly with the provider who is going to be doing the injections. So we want this continuity of care. We want your initial appointment, the talking portion, the physical exam, the imaging review, to all be completed by the person who's actually going to do those injections. Unfortunately, there are a lot of clinics out there who might have one physician or a chiropractor who determines what injections you may need, but then those injections are actually performed by someone else. That may indicate that you're not working with a high tier clinic, because we want that continuity of care. And at the end of the day, the person doing the injections should be the person responsible for diagnosing you with what structures are actually causing your pain. So that way it's going to give you the best chance of having an optimal response. Number 8 is going to be that the PRP dose is measured. And so there are different ways that this can be done, but a lot of clinics are actually going to have an in-house hematology analyzer, which is basically a fancy machine that's going to tell us how many red blood cells, how many white blood cells, and how many platelets are present both in your whole blood and in your PRP. Because the emerging literature is really starting to show us that the dose of PRP matters, top tier clinics are going to understand this and are therefore going to spend the money, the time, and get the training and expertise to make sure that all of the injections that they're doing are sufficiently dosed for that pathology, so that way it's going to give you a higher % chance that you're going to see the positive response, which is important, especially when you are paying your hard-earned cash for these procedures. Number 9 is that the clinic is part of a registry. So a registry basically is a company/software program that is going to track the outcomes of patients that undergo injections. So if you're part of a registry, you will know this because you'll be getting texts and emails asking you to fill out questionnaires that are tracking, are you having any adverse events? How well are you doing? How's your pain levels? How's your function levels? Are you satisfied with the procedure? All of those things in top tier clinics are going to get tracked because it does several things. The main thing it's going to do is it's going to help inform for future patients. So I can go look at my data and I can then talk with the patient to say, hey, in our practice, we have a 90% satisfaction rate at 6 months or a 95% satisfaction rate at 12 months. And so now we have some hard concrete data that we can tell patients, this is our data from our registry that we are a part of, which is going to inform the care of that patient. And so this is what a lot of top tier clinics will do. And the last one is that the clinic and the provider are not an injection mill. They are not running through 30, 40, 50 patients a day, one quick shot, boom, move on to the next one. One quick shot, boom, move on to the next one. Top tier clinics are going to spend their time with you. They're going to be meticulous in their injection approach, and that is going to take a lot more time, and you're not going to be able to see 30, 40, 50 patients in a day doing that. And so top tier clinics are going to spend more one-on-one time with you in a more personalized and one-on-one approach. These are the things that I consider to differentiate the top tier clinics from everybody else. Now, do you need all 10 of those? No, I don't think you need all 10 of those. And I don't know where the appropriate number lies. But the lower you get, if you only have 2 or 3 of these, then you might not be working with a top tier clinic. If you have 7, 8, 9, 10 of these, then there's a higher % chance that you are working with a top tier clinic. Now again, I will stress that not everybody needs to work with a top tier clinic. There are a lot of people who are going to see a response from a clinic that maybe only satisfies 3 or 4 of these compared to a clinic that satisfies 9 or 10 of these. But how I think about it is this. If on the lower tier clinics, you have a 70% responder rate, which means that 70% of patients are going to see significant improvements, that's great. But if you work with a top tier clinic, you could be moving into the 85, 90% responder rate. And so what that may mean for you is, without knowing if you're going to fall in that 70%, essentially by working with a top tier clinic, you are increasing the odds that you are going to see a positive response, which means it's going to increase the odds that the money you are spending is well worth it. And you'll know it's worth it because your pain is getting better, you're able to do more in your life, and you are regaining and reclaiming your life from your chronic pain.